This is Eileen Fee from Transform Your Body Fitness. I'm a physical therapist and a fitness coach. So what do I have for you today? Do you have plantar fasciitis pain? If you know how to pronounce it, then you probably have it. It is an extreme amount of pain down by the heel area. The fascia connects through the whole foot. It runs from the base of your toes down the middle of your foot, but it mainly connects into the heel or the calcaneus. That's the bone of the foot, and that's where most people feel their pain. So if you've been through physical therapy, then you're used to having deep tissue massage there. So I want to provide a few things that you can do at home, because again, this series is about bridging the gap between physical therapy and home fitness. So there's going to be a little bit of overlap, and I think I'm going to provide a couple of things that you haven't seen yet that is going to help relieve your pain, because I know how painful this is. I've had it. So the first thing, you need something to provide that soft tissue massage. And you need something like a tennis ball or hard ball or a foam roller. All right. Now, if you're using the method with the ball, you're going to either stand on it or you can sit and do this, but you need to apply pressure as you're rolling it back and forth. You're just not lightly doing it, you're really pushing in. But you need to concentrate on the heel area. All right, really, if you need to, you just hold it. And the same thing, if you're using the method with the foam roller, you can really push in, but concentrate on the heel. Okay, so that's the deep tissue massage. You also need to stretch the area out. You can use a long towel. You can use a long sheet. I'm using a belt. And what you do is you're getting it so that you can hold the handle at the end. The motion you need to do is bring your toes towards you, because again, where that tissue is at the bottom of the foot, you want to stretch that out. You're able to, in this position, with your toes towards you, you're stretching not only the tissue on the bottom, but especially down by the heel, and you're also stretching the Achilles tendon. So you hold that stretch for 10, 15 seconds, all right, and you repeat that. All right, so that's something I'm sure you've done in physical therapy. Now, in addition to those things, you need to do strengthening work, because that's not going to relieve the pain right in the immediate time, but you need to do strengthening exercises to prevent the pain from happening. The calf muscles, if they're strong, will take the pressure off the plantar fascia. I've done a video series on calf strengthening. Look that up and take a look at that. It will really help. Beyond those things, you also need to take a look at, and I talked about this in another video series, using apple cider vinegar, using the basin method, will help draw toxins out of the bottom of your foot and the heel area, and I'm telling you that will relieve a lot of pain. Some of you are questioning that. Take a look at that video. It will answer a lot of those questions. Now, one of the things I notice and hear all the time is that patients say to me, my first couple of steps in the morning, I see stars, and it's so painful, and then as the day goes on, it gets better, but it's those first couple of steps, it kills me. So one of the reasons why is because when you're sleeping in bed, your feet are in this type of a position. They're hanging down and usually out. What I'm going to try to suggest to you, just grab a stack of pillows at the end of your bed and have your foot so that it's trying to maintain a neutral position. And the pillows are going to try to block you from having your foot hang down like that. So they may not totally do it. There's also what's called a night brace. The night brace will hold you in that position, but you may want to try the pillow method first, you know, because sometimes wearing a brace to bed, that's not something I really want to do. But the pillow method does seem to help, because that's, if you can keep your foot in this position, then when you go to get up, you're not going to feel that pain in the morning that you just see stars, okay? And it's because that position puts a lot of pressure in that heel area. So being in the neutral position, especially through the night, will help take that pressure off. Some of the other things are footwear. I have noticed that if you wear a wider shoe or a sneaker, it helps to take the pressure off the whole bottom of the foot and the heel area. Sometimes people have worn orthotics. I'm not a fan of orthotics. I would actually have you try to experiment with your footwear. You may need to consult a podiatrist. You may need to consult somebody that sells shoes and knows a lot about the biomechanics of shoes. But just quickly, I can say, typically speaking, your shoes are too tight and it's putting too much pressure on that area. Typically, you need a wider shoe or a sneaker to take the pressure off. So think about that. And one of the last things I want to put out there is using Kinesio Tape. Kinesio Tape is a special kind of a tape. It's not meant for support, it's meant for pain relief. They sell them in stores. Your physical therapist usually has them. So I just want to give a quick little showing you how to use the method of applying the tape to relieve plantar fascia pain. Make sure your foot is cleaned off. All right, you want to hold your foot in that neutral position. All right. So the key is that I'm going to apply the first piece of tape at the bottom of the base of the toes, and I'm going to come up. I'm going to go all the way down and around and right above the heel. Okay. Now, the amount of pressure you put in is, let's see, you apply the tape here, all right, then when you're coming up, apply a fair amount of pressure. They say 70-75% pressure. Okay, along the bottom of the foot, and then you insert it just up at the top. Just no pressure along here, but put the pressure along the bottom of the foot. All right, because that's really where you want to have it, along the bottom and by the heel. All right, now you use the other piece of tape. And you're doing it so that it's going across the calcaneus or the heel, and you're coming up top. Putting pressure along here and just slightly putting the tape along the sides of each ankle. You're going over the ankle bone. Okay, so the pressure's along here and here for the first piece. The second piece, as you put it on, there's the pressure, and you gently put it on, and then you just keep going like this with the tape. This is an easy method to use. It's something that, typically speaking, the tape stays on for 2 or 3 days, even with showers. But if you're doing the massage with the ball and soaking your foot, you may not want to keep it on 2 or 3 days. The point is that here are some things to help relieve your pain. This is about bridging the gap between physical therapy and home fitness. You need to be able to do things on your own. So I hope some of these tips helped. Apply some of these tips. I know that they're going to help relieve your pain. They've helped me. I've also had plantar fasciitis. So hope this helps. It's about staying as healthy as you can for as long as you can. And stay tuned. There's more to come in the pain relief series. Have a great day, everybody.